Okay, ladies, we're going to do a recorded chapter review for chapter 15 and chapter 16. Your test will be on Monday. I have pulled up the Pearson study guides off of the Pearson website, and we're just simply going to go over the study guide test questions that they have available on here. We're going to go over them together. So we're going to start with chapter 15. Chapter 15 is your ICD-10 coding. And while it's waiting, if you have any questions regarding coding, I have looked on YouTube. There are several videos on ICD-10 coding. We do have books in the classroom, so once we return, I will be able to pass the books around, kind of give you a feel. That way you can see what they are and how they are set up, how they're designed. So this looks a little different. So we're going to expand all, and I want to see everything. So these are already answered for me. Here are our questions over here, and these would be our options. So I did this method to show you, let's go over the question and then the answer over here on the right side. So your question would have been to indicate the definitive diagnostic statement by the physician regarding the reason for the visit, which of the following terms is used, and it's going to be the first listed diagnosis. Now, this is what the clinic will be billing for that patient's visit. Remember, the diagnosis list is separate from the problem list. Which of the following is a mandate of the Patient Protective and Affordable Care Act? We did discuss this. It is a compliance program for providers who contract with Medicare and Medicaid. So remember that. Those are your keywords here, Medicare and Medicaid, for your Patient Protective and Affordable Care Act. To identify two conditions that commonly occur together, which of the following codes are used? So this is going to be your combination code. You could have multiple or qualified diagnosis. But here's your keywords. So pull those out. Commonly used together. So together, combination. Okay. So if it were to have said more than one, then that would be your multiple coding. Which of the following does not describe the role of a medical assistant in coding? Perform medical coding as a regular part of their job. This is true. Okay. So let's see. Which of the following does not describe the role of medical assistant in coding? Aid communication between physician and coders. That is correct. Aid communication with attorneys about injured patients they represent. Answer patient questions about coding on bills. So your response is going to be perform medical coding as a regular part of their job. It is best for a medical assistant to do which of the following when the assistant is asked to help with coding, but is unsure which codes apply to a particular patient. You are going to consult with a certified coder. Okay, you do need to remember this. I have seen this more than once. So this will be, you as well will see this again. You're going to consult with a certified coder. To ensure that records in the medical office are in acceptable form, which of the following tasks should the medical assistant routinely perform? You will review medical documentation to ensure that it provides adequate detail for coding. So it is your job to make sure that the physician as well, not only yourself, but the doctor that you are working with or working for has provided all the documentation that is needed for adequate billing. Also, remember, if it's not charted, it wasn't done. Jacques Bertillon advanced medical coding by doing what? Creating the classification of causes of death. So this is going back to or referring to the history of medical coding and billing. This is the name of the person that created the classification of the causes of death. The first United States publication of the Internal Classification of Diseases adapted is the ICD-A-8, coincided with which of the following events? Medicare and Medicaid legislation was passed. So again, this is the history of the ICD-10 coding. You will not be required to know this for test purposes, but you may see this again in the future. The need for which of the following is reduced when detailed diagnosis codes are used for claims? This is going to be attachments. Your other options are going to be pre-authorizations, reconciliation, and adjustments. So your need for attachments is reduced when detailed diagnosis codes are used for claims. So this is saying the need for attachments. So let's say, for example, if you are getting emails with attachments on them, the need for the billing office to send all of the extra information is going to be reduced if adequate charting is already done and adequate diagnosis codes are being billed. All of the following are benefits of the conversion to ICD-10, except which one? Other countries become more consistent with the coding system used in the United States. So here, your other options would be, so if you are not if you're not sure of the correct answer, whenever you see the word except here, go by your process of elimination. So your other options are going to be more specific code descriptions help reduce coding errors. That is true. We learned that with your benefits of ICD-10. Public officials can better track and respond to domestic and internal public health threats. That is true because the ICD-10 is more descriptive. The new set provides flexibility to add codes in the future, and this is true. So the one that is not true here are the other countries. Each of the following is considered a major type of information related to the general organization of the ICD-10 CM manual, except which one? Conventions. Conventions are going to be one of the sections in your ICD-10 book. So which one, of course, okay, go back to your question. Each of the following are considered a major type of information related to general organization of the ICD-10 CM manual, except which one? So when you have an ICD-10 manual, the first thing is going to be your introductory material. Your index is going to be in the back, and then you have your tabular list. Two tables that provide quick lookups, one for neoplasms and one for drugs and chemicals causing injury, are located where in the ICD-10 manual? This is going to be in your index. This is in the back of the book. And there is a special section. We learned in the first part of our chapter that there are special sections for neoplasms and drugs and chemicals causing injury. The official guidelines for coding and reporting, that is going to be the OGCR. Instructions for using the manual, universal conventions, and publisher specific conventions are located in what part of the ICD-10 manual? This is all going to be contained, and it will be located in your introductory material. That's going to be at the front of the manual. The location for the alphanumerically sequenced list of all diagnosis codes divided into 21 chapters based on cause or etiology and body systems is which of the following? That is your tabular list. Remember how I said when I held the book up, it is divided by tabs. That is your tabular list. What document is always necessary to consult when coding a diagnosis? Well, first off, you have to have that patient's record. That's going to be key. That's the only way you're going to be able to code. Diagnosis coding involves which of the following sets of steps? Here, first off, you need to identify your first listed diagnosis. That was in the first question here. Research the diagnosis in the index and verify the code in the tabular list. So you're going to look at your documentation, find your diagnosis. You're going to go to the back of the book in the index, look the code up there. Then you are going to go to the tabular list and scroll down and make sure that the diagnosis code given in the index is the same as checking medication. Before you administer medication, you check it 3 times. Same thing here. Your diagnosis list from your patient record, your index section, and then again in the tabular list. Diagnosis codes must describe which of the following terms? The reasons that the specific service was provided and the related medical conditions that may affect the specific service. So your diagnosis code must describe the reason for the patient visit, the reason for their treatment. When coding for burns, which of the following statements is false? Subterms to explore include chemical and heat. Your key word here that makes it false is subterms. It needs to be a main term. When coding HIV, which of the following is not a subterm? Okay, so HIV is the human immunodeficiency virus. So the word human here is not subterm. Human is going to be the main term. A special situation for coding is presented by which of the following conditions? High blood pressure, shingles, strep throat, or sprained ankle. So a special situation for coding presented by which of the following conditions are going to be high blood pressure. So that concludes chapter 15. I'm now going to open the study module for chapter 16, which is the next chapter, and it coincides with ICD-10 billing. And if you have your code, if you have the new book and you did receive the CD with your book, you are able to access My Pearson Lab online to be able to work these if you would like to. You do not have to, it's not a requirement, but if you would like that extra help, extra guidance, it is here for you. Go ahead and use it. That's what it's here for. So procedures and services are listed alphabetically by your main term in what part of the CPT coding manual. And this is going to be in your index. Your index is listed in alphabetical order. Coding for a lower level of service than was actually provided is referred to by which of the following? That is down coding. I had you do the difference between up coding and down coding, and coding for the lower level of service that was provided is down coding. It is also fraudulent. So you will see this commonly be done if a physician maybe is trying to do a favor for a patient or a family member or that sort of thing, and they down code so that the patient will be responsible for a lower bill, and that is fraud. When the abstract procedure information to code for services and the reason these services were provided, medical assistant will use which of the following? This is going to be your patient record, the medical record. Uniform standards for electronic transactions were required to be established by which legislation passed in 1996, and this is HIPAA. You will see HIPAA again and again, more and more and more. So just remember HIPAA, I have talked about it and pounded it, and you're still going to hear it once you graduate school and move on. The requirement to include diagnosis codes with CPT procedure codes that explain the reason for an encounter or that services were provided is referred to as what? That is medical necessity. So look at your words. So the requirement, what is necessary? Requirement, necessity. For each CPT code and the one or more diagnosis codes that identify medical necessity, which of the following is the best description for what must be done? They must be cross-referenced. So it's kind of like you're checking your work twice. So if you have more than one diagnosis codes that identify your medical necessity, meaning, have you heard someone with more than one medical diagnosis, medical condition, which one takes prevalence over the other? So they're going to be cross-referenced. Making false statements or representations of material facts to obtain a benefit or a payment for which no entitlement would otherwise exist is an example of what? This is fraud. An example of Medicare abuse is which of the following activities? Right here again is going to be charging and billing. So they are charging excessively high fees for services or supplies. That's going to be falling under an example for Medicare abuse. What practice may seem prudent to avoid fraud, but deprives the medical office of reimbursement it is legally entitled to receive? This is downcoding. Okay, so again, pull out your keywords. Deprives the medical office of reimbursement. So what does the word deprive mean? It means you're not getting something. So they're downcoding. So you're not going to get that full benefit of what that insurance is going to pay if you downcode. Which of the following terms describes reporting a procedure code for a higher level of service than was actually provided, resulting in higher reimbursement? That is upcoding. This is also fraud. To find examples of E and M code scenarios for many medical specialties, which appendix of the CPT manual would you consult? This is going to be your Appendix C, clinical examples. There are different sections of the CPT manual, just like the ICD-10 manual. To find the official descriptions of CPT codes and the guidelines for using them, what section of the CPT manual would you consult? This is going to be the tabular list. So this here is the same as your ICD-10 book. So pull out your keywords again here, y'all. In the question before, clinical examples, that was Appendix C. So if you're not sure, read your question, even if you have to read it more than once. Go over your choices and pull out, even if you are not able to find it, let's say, for example, mark the one that you feel is the correct answer. To identify the preliminary codes for procedures, the medical assistant should consult which section of the CPT coding manual. Okay, so here we are, preliminary codes for procedures. So we're not sure of something yet, so we're going to look in the index. So your index, you look it up there, then you go to your tabular list. Okay. To combine services when a single code includes multiple services, which of the following would you use? This here is going to be bundling edits. This has to do with CPT coding. So you have okay, so let's go over it again. To combine services when a single code includes multiple services, which of the following would you use? Modifiers, quantity edits, add-on codes. This is going to be a bundle. Multiple, bundle. If a patient received a general multi-system examination, how would you classify the complexity of the assessment? This is going to be comprehensive. This will have to do with billing. It'll be a comprehensive visit because there's multiple problems that the physician needs to work out, and that will be coded as a comprehensive visit, and this will be a higher pay visit. Counseling, coordination of care, and the nature of the presenting problem are referred to which of the following? These are your contributing factors. So this is also will be your problem list of what's going on with your patient. Counseling, what was your problem list? What was the plan of action? What did we do to our patient? And what are we going to do next? Okay, that's your contributing factors of, and not only for billing, but how you're going to take care of your patient's needs. Which component of a radiology code involves creating the image and includes personnel and equipment? Personnel and equipment. This is going to be technical. So we have radiology code involving creating the image and includes personnel and equipment. So think about your word equipment here. You have technical. What is the name for the surgical concept that all CPT surgical codes include? Also known as the surgical package. This is referred to as global. So think about something big here, surgical concept as a whole. Whenever you think about a surgical package, I have that image of the whole world, so this is global. So maybe kind of tie those two together to help remember those two. The modifiers that further describe circumstances when appended to CPT or level 2 codes are which type of code? These are going to be your 2-digit alphanumeric. So, okay, we have a couple of choices here. So you have a 3-digit alphanumeric and 2-digit alphanumeric. The correct response here, okay, you've got the level 2-digit. CPT and ICD-10 are alphanumeric. So that's your clues here for this question. A clinical social worker in medical office services would be designated with which HCPC modifier. Okay, so I think I even asked you guys this. So this is the abbreviation HCPCS. You will also hear it be called the HCPC code, HCPC, okay? So your correct response here is going to be AJ, okay? So that concludes your Chapter 16 procedure coding test review. We will have this exam on Monday. So review your chapters, review the terms of your chapters, the questions at the end of Chapter 15 and Chapter 16. And also, if you have not completed the study guide that I sent you a day or so ago, you really need to open that and answer those questions and use that as a study guide. If you have any questions, please reach out to me. I love you guys, and I will talk to you soon. Bye, ladies.